Okay, go ahead.
I was very much surprised to attend this today because when I had spoke to you on the Philip on the telephone, I thought it was going to be something like a clinical pathological conference, but instead it turned out to be something much greater, bigger, more organized, and I think we should have a lot of thanks to the guys that organized this and put on this very helpful conference. The one thing that I did learn is that my hearing is not good enough and I should get a hearing aid.
And how many years did we figure out you practiced family medicine for?
From 1951 till 2007.
Okay.
Before that, when I got out of school in '48, I went to Cincinnati General Hospital, which is now University Hospital, and we took a rotating internship. The first service I had was obstetrics, and I was on there for 2 weeks and developed 30 primips. You would stand between the two delivery rooms and see which one was going to go first. They'll go to the right, to the left. And then after you took your services like OB and PD and medicine and psych and so on, then you would finally choose what you wanted to specialize in. Maybe specialize in emergency room medicine, or maybe psych, or surgery was a good service down there at that time too. And I considered that for a while, but I think I don't have as good a hands as I should have.
Now, you said you remembered the Southern Medical Association from St. Louis. About what year would that have been?
Yeah. I was at St. Louis University Medical School from 1944 to 1948, so it had to be in those years that the Southern Medical Association put on a big meeting at the Kiel Auditorium, which is the main auditorium down by the depot, the railroad depot in St. Louis. But the St. Louis was really a big one.
Other medical somewhere that you count on for good education stuff for physicians then?
Yeah,
known for that?
Well, you didn't need continuing medical education at that time to renew your license. So once you got your license, you were good forever. But I think the AMA finally decided that doctors needed a little brushing up. There's a good saying, and I think it's very true, and then they say, "Doctor, if you don't use it, you lose it."